Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to talk to y'all about compounded semaglutide and why I'm comfortable prescribing this medication. There's been so much misinformation that's been given to the public, and I think a lot of that has to do with the fact that the large pharmaceutical companies want to protect their name and want to protect their reputation, which is absolutely their right, for sure. There are some products being sold online that are unsafe, but if you go about it the right way, then I think compounded semaglutide is perfectly safe. And let me tell y'all a little bit about how I do it and why I do it and where I'm getting the medication. So first, when I write a prescription for compounded semaglutide, I know that that prescription is going to a reliable compounding pharmacy. I did my research, and you can too. I want you to Google Be Safe RX and look at the compounding pharmacy that you're getting the medication from. And there are specific places to look to ensure that this pharmacy has not had any safety concerns. You know, there's actually a compounding pharmacy that I refuse to use because it's had several safety concerns that have been filed against them by the pharmaceutical industry, and most recently in March of 2020. So I just avoid that compounding pharmacy. If you decide to go the compounding route, you need to ask your physician where he or she is sending your prescription so you can do some research as well. The compounding pharmacy also needs to be a sterile compounding pharmacy, and you can find that also in Be Safe RX. Because semaglutide is an injectable medication, it needs to be made under a sterile hood in sterile conditions, and that's really important. Next, I don't receive any money or kickbacks when I write a prescription for compounded semaglutide. It's completely separate. The patient pays the pharmacy directly. The pharmacy ships it directly to the patient. I don't receive any monetary gain. And I just want to warn people that if your doctor or your med spa or wherever you're getting your compounded medication is getting benefit monetarily from it, I would be wary. I want to talk to that compounding pharmacies are getting semaglutide from FDA registered facilities. They're getting it from a reputable source, and any reputable compounding pharmacy is going to do that. Next, I don't add anything to semaglutide. I know other physicians can add B12 or other additives to the semaglutide, but I don't do that. I don't think that's a good idea at this point because we don't really know how other ingredients will interact with the semaglutide, so I strictly write for semaglutide. You know, the reason why I'm able to do that is that semaglutide, also known as brand name Wegovy and Ozempic, are very, very difficult to get right now. There is definitely a drug shortage. I have so many patients that want to take Wegovy or Ozempic and they're unable to find it. And if they do find it, it's incredibly expensive because a lot of insurance companies are refusing to cover them, and then employers are also opting not to cover anti-obesity medications. Whereas Wegovy and Ozempic without a coupon cost about $1,200 a month, compounded semaglutide tends to be around $300 a month. You can certainly find it cheaper, but I would be wary about getting it at a bargain basement price. I think realistically, you should be spending a couple of $100s a month to get it from a reputable compounding source. At the end of the day, I really encourage everyone to use their common sense. Please don't buy semaglutide from an online source without talking with a knowledgeable physician, preferably trained in obesity medicine. There are ways to use these medications well, and then there are ways to use them in an unsafe way. The Alliance for Pharmacy Compounding wrote an excellent document if you have more questions about compounding semaglutide and why that's allowed right now. They're updating it about every 3 months, and it's just an excellent resource for getting some other questions answered. Thanks for joining me.